This segment of Delmarva Life is brought to you by Tidal Health.
Ever have a gut feeling about something, a gut instinct? Well, most of us tend to trust our gut, but do you really trust that your gut is actually healthy?
Well, that's actually a whole different conversation. One you might want to have with this man right here. This is Dr. Osama Kadora. He's a provider at Tidal Health Gastroenterology. And thank you so much for joining us this afternoon.
Thank you for having me.
Yeah, okay, so we kind of know, but can you kind of break it down? What does a gastroenterologist do?
So a gastroenterologist is a specialized physician. We basically focus on what we call a GI tract. Basically, it starts from the mouth down to the stomach, the food pipe in between, the small intestine, the colon too. So all of that is within our specialty, along with the liver and the pancreas, which is what we call accessories for the GI tract. What we do is we diagnose diseases and treat. But what really we're proud about is basically screening for diseases too. So colon cancer screening is part of our job, actually is a big part of our job, so we do that almost every day. Along with pancreatic cancer, gastric cancer, so screening is a big part of our job too.
So besides the cancers that you just mentioned, what other health conditions could be caused by poor health? Or poor gut health, I should say.
So a lot of things, starting from simple things like constipation and diarrhea, which can have really a drastic impact on someone's life, to more serious and more concerning life threats like cirrhosis of the liver, for example. Those cancers I just mentioned, along with inflammation, infections through the GI tract, we deal with that all.
Okay, so when should you make an appointment with a gastroenterologist? I mean, you know, what kind of symptoms would warrant that?
It's a really good question. So most of our volume or patient volume comes from primary care doctors through referrals, but self-referrals is also part of our referrals. So we ask patients whenever they have GI symptoms like constipation, diarrhea, it's been chronic. What we mean by chronic is more than a month or been there for a few weeks. We also get concerned about what we call red flags, basically blood in your stool, weight loss, problems with the swallowing. Probably that's the time to check if you need to see a gastroenterologist.
What about, like, you know, problems up here in the upper part, like, you know, heartburn or reflux and things like that? Is that something that...
Yeah, that's pretty common. We see that almost every day in our clinic, in our office. We have a lot of treatments for that. Heartburn and GERD can really impact patients' life, and we actually encourage patients to seek treatment and care for that, because as I said, there's a lot of treatments for that that actually can improve quality of life for those kind of patients.
Well, you mentioned colon cancer. Colonoscopy is always a big topic. At what age would you recommend men and maybe women start looking for doing a regular colonoscopy visit?
I'm glad you asked that. So colon cancer screening should become a norm, should become a culture here in the US, honestly. A lot of celebrities right now are open with their colonoscopies. We really encourage patients to seek that kind of information. So the age we start for healthy patients right now is 45.
Okay.
Whether you're a male or a female at 45, if you don't have what we call risk factors. So basically, if you don't have any family history of colon cancer, if you don't have any symptoms at all, that's the age you need to look for colon cancer screening at. But that changes for special populations, like if you have a family history of colon cancer, or if you have symptoms, then that can go even younger than 45.
Yeah, and then they have these at-home screenings as well.
That actually helped our job a lot, especially with compliance. It's just a stool test that they do at home, and they send the kit to the lab, and they can get results of how suspicious or how risky they are for colon cancer and how urgently they need the colonoscopy. So those stool tests actually really helped our job with the colon cancer screening around the world.
I bet.
And without having to come visit, make an appointment, what are some things that Lisa and I and everybody else can do to just help our overall digestive health?
Well, simple advices would be eat healthy, drink a lot of water, get some fiber in your diet. That will help with your bowel habit, which should be regular every day. Just be cautious and be aware of all these symptoms that you need to seek care for, like blood in the stool. Try to watch your stool every time you go to the restroom. Try to look for blood if there's any. Weight loss, you should be aware of if you have losing weight, you have to seek care for that too. But generally, just be aware for those kind of symptoms. Try to eat healthy and drink a lot of water. That would be my advice.
Yeah, try to stay healthy.
Yep.
All right. Thank you so much, Dr. Osama Kaddoura, a provider at Tidal Health Gastroenterology with locations in Salisbury, Berlin, and Seaford.
Oh, thank you. Appreciate it.